Hello, everyone. Welcome to another review class from LAMP. And we also would like to welcome our participants from PAI, Philippine Academy of Acupuncture. Today, we shall be reviewing the 5 Shu points. And we would like to request the participation of Ma'am Trix Guevara of Sampaloc, Manila. Good afternoon, Ma'am Trix.
Good afternoon, Doc.
Yes. So, good afternoon. So, how do you define the 5 Shu points? These are actually special points. Ako na lang maglagay, ha? So these are actually points on the 14 meridians. So that includes the two extraordinary vessels, no? With specific therapeutic properties. Since specific points have different distributions, indications, and functions, they have different names, and there are 10 categories of these points. Okay? So we hope that from this day on, we shall be reviewing all the special points, we call them. And for this afternoon, we would like to um, concentrate on 5 Shu points. Okay, what are 5 Shu points, Ma'am Trix?
Uh, they are the Jing Well, Ying Spring, Shu Stream, Jing River, and the Hussey.
Okay, so they're actually located between the toes and the knee, and also between the fingers and the elbow. We would like you to imagine, because the names are very descriptive, no? Jing Well, so that's the well. And then from the well, we go to the spring, then the stream, then the river, then the sea. So these are located below the elbow or the knees on the 12 regular channels. And they are situated from the distal ends of the extremities to the elbow or knee. Okay, so what are the 5 Shu points of the lung?
The first is the Long 11. It's the Jing Well. Next is Ying Spring, the Long 10, Shu Stream, Long 9, Jing River, Long 8, and the Hussey is the Long 7. 5.
Okay, so we memorize lung 11, 10, 9, 8, 5. No? So it's like trying to remember somebody else's number. 11, 10, 9, 8, 5 for the lung. Okay? For the pericardium.
Jingwell is the pericardium 9. Ying Spring is pericardium 8. Shu Stream, pericardium 7. Jing River, pericardium 5. And the Hussey is pericardium 3.
Okay, good. So it's 98753 for the pericardium. For the heart.
Heart, Jingwell is heart 9. Ying Spring, heart 8. Shu Stream, heart 7. Jing River, heart 4. Hussey is the heart 3.
Okay, so it's 98743 for the spleen.
Jingwell, spleen 1. Ying Spring, spleen 2. Shu Stream, spleen 3. Jing River, spleen 5. And the Hussey, spleen 9.
Okay, it's 12359 for the liver.
Jingwell is liver 1. Ying Spring, liver 2. Shu Stream, liver 3. Jing River, liver 4. And the Hussey is liver 8.
So it's 12348. Kidney.
Jingwell is kidney 1. Ying Spring, kidney 2. Shu Stream, kidney 3. Jing River, kidney 7. And the Hussey is kidney 10.
Okay, it's 123,710. For the large intestine.
Jingwell is Li1. Ying Spring, Li2. Shu Stream, Li3. Jing River, Li5. And the Hussey is Li11.
So it's 123,511. What about San Tiao or triple burner or triple warmer?
Jing Well is triple warmer 1. Ying Spring, triple warmer 2. Shu Stream, triple warmer 3. Jing River, triple warmer 6. And the Hussey is triple warmer 10.
Okay, 1, 2, 3, 6, 10. Small intestine.
Um, Jing Well is SI1, Ying Spring SI2, Shu Stream SI3, Jing River SI5, and the Hussey is SI8.
So it's 1, 2, 3, 5, 8. Stomach.
Jing Well, Stomach 45, Ying Spring, Stomach 44, Shu Stream, Stomach 43, Jing River, Stomach 41, and the Hussey is Stomach 36.
So it's 45, 44, 43, 41, 36. Gallbladder.
Jing Wells, GB 44, Ying Spring, GB 43, Shu Stream, GB 41, Jing River, GB 38, and the Hussey is GB 34.
44, 43, 41, 38, 34. Urinary bladder.
Jing Well, bladder 67, Ying Spring, bladder 66, Shu Stream, bladder 65, Jing River, bladder 60, and the Hussey is bladder 40.
67, 66, 65, 60,
Or
40.
40.
Okay, what are the actions of the 5 Shu points in general? No, I'm sorry. What are the actions happening at the 5 Shu points? So this is a very good way of remembering the functions or what happens at each of these 5 Shu points. Let's start with Jingwell.
For Jing Well, the meridian sheet starts to bubble. And then the Ying Spring meridian, the chi starts to gush.
Mhm.
The Shu Stream Points, the meridian chi starts to flourish. The Jing River meridian chi is pouring abundantly, and the Hussey signifies confluence of rivers into the sea.
Okay, so the key words bubble, gush,
Gush,
flourish,
flourish,
pores,
abundant,
pores. Oh yeah, pouring abundant
pour,
pores,
pour
and
abundant.
then um, confluence and sea into the sea. How to treat excess versus deficiency disease? Okay, so let's go to treatment now. Let's start with excess
So
disease. Yeah.
yes, for excess, reducing sun point of the affected channel and reducing sun channel, same face point. For deficiency, is tonifying mother point at affected channel and then tonifying mother channel, same face point.
Okay. I don't know if some of the participants today are familiar with the 4-point needle technique, no? So if you wish to master the 4-point needle technique, you need to know these things. Okay, so for excess, of course, pag excess, we have to reduce. But again, you have to first look at the affected channel. Um, so you need to know the five Shu points of the affected channel. So in this case, you need to, if it's an the excess disease, you have to reduce the sun point. Example, if it's the liver, no, um, that you need to reduce, you need to do the sun point. So the sun point would be the fire point, diba? That's the sun point of the affected channel. Okay? Because the liver is wood, diba? So yung sun niya is fire. So you have to look for, since the liver is the affected channel, the sun point would be the fire point. So of course, there is also what we call the horary point. So that means it's um, the wood point of the wood channel or of the liver channel in this case. No? So you also reduce the sun channel of the same phase point. Okay. So this time you have to think of the channel. Okay. So um, the channel would be what is the sun channel now? It should be the fire or the heart channel. Huh? So you have to reduce the 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 fire point of the fire channel. For deficiency disease, you tonify the mother point of the affected channel. So if we're talking about the liver, the mother point is supposed to be the water point, diba? Hmm. And also, speaking of the another channel, so the mother channel of the liver channel would be the kidney channel. So you'll be looking at the water point of the kidney channel, which is called the horary point. Okay, let's please discuss the use of the Jing Well points.
So if there's fullness in the epigastrium, the liver or wood, it's a liver or wood disharmony. It's also good for emergencies or really high fever, and
Oh,
it's a indication of internal wind.
okay, so a very good um, use of the Jing Well would be when you have epigastric fullness, which happens when you have liver wood disharmony. This is quite common in the clinic, no? Because of stress. Diba?
Mhm.
So if there is stress, what happens is the liver is very over controlling, so it weakens the stomach. Okay, so you'll have fullness in the epigastrium. So that's a very so you have to use the Jingwell point. This is also good for emergencies, very high fever, internal wind. Okay. Another would be the Ying spring. What is the best use of the Ying spring? Remember earlier the Jingwell, this is where the chi bubbles, right? So what
Mhm.
happens, Mom Tricks, Ying spring? What happens to the
So
chi?
if there's it uh gushes,
Gaseous, gaseous.
gushes,
Parang
gush.
gosh. So that's the key, the clue, gosh. So what is the use?
If there's heat pattern
Yeah,
or heart fire problems,
yeah. So heat pattern, you use the ing spring point. Now, what about Shu Stream? What happens to the chi at the stream?
it flourishes,
Flourishes. So that means
flourishes
it's proliferate. It's growing. Okay. The,
like a flower.
yes, like a flower. So, what is the use? The very common use of the Shu Stream.
If there's heavy sensation of the body or painful joint.
Yeah, so this is usually true when you have spleen problems, diba? Dampness, phlegm, diba? Oh, swelling. No. So the patient will always feel, I feel heavy, no? And that particular joint will also feel heavy. So you use a stream point, Shu stream point. What about Jing River points?
Um, if there's cough and asthma due to pathogenic cold or heat,
Okay.
or
Beginning,
long,
yeah,
long
so are you beginning to see a pattern? This is already lung, metal, diba? So shoe stream is earth. That means the spleen. And then if you have a fire or heart problem, we use ing spring. Then if you have a wood problem, um, like liver cheese stagnation, you use Jingwell. Diba? So obviously, the C would be what?
mm,
What element?
with
The water.
water. Yes,
Water.
sorry,
Water or
no
kidney
more friendly.
siya, kidney issues, 'di ba? Make sense? Mm.
Yes.
So, what's the use?
Uh, mhm. It's used if you have diarrhea due to rebellious chi or Zhang organ disharmony.
Okay, there. Rebellious chi. Um,
Mm.
okay, the rebellious chi here is caused by a Zhang organ disharmony, no? So kidney water
Not
affliction.
kidney, not uh,
So there's a pattern na, di ba? May pattern na. Okay. What does Shu mean?
Shu means transporting.
Okay. So five Shu is also known as five transporting points. So five Shu points are also known as,
The element points or command points
yes,
because they are assigned to the five elements.
it's nice, no? So there are five. They're also called the element points. So if you have uh, kidney or water issues, what's the best point to use? You use the C point, no? Whole C point.
Oh,
If it's the if it's fire, you use the Ying spring. What are three reasons for the dynamic nature of points at the end or beginning of a channel? The Jing Well and the Hosi.
the channel is more superficial.
Okay.
There's also change in polarity from yin to yang and vice versa. And then the second point is in contrast with the polarity of the channel, or the water for yang and fire for yin channels.
Yes. So just like when you have Li2 is the water point, and the second point is Lang 10, which is a fire point. So can you imagine if you master the five Shu points, you have like five 5 points for every channel. So 12 times 5, you would have mastered 60 points already. Okay. Jing Well for the yin channels is which phase?
The wood face.
Wood. So if it's liver is a yin channel, the Jing Well would be wood. So doon mag-i-start wood. And of course, the Jing Well for yang channels is which phase?
The metal.
Metal. So if it's the gallbladder, the Jing Well would be metal. How many yang and yin channels are there in the extremities?
There are three yang and three in the arm, and then three yang and then three in the legs.
Okay. What are the starting points for the arm yang channels?
SI1, LI1, and Sanchow 1.
Yes. And for the leg yang channels, what are the starting points?
Bladder 67, gallbladder 44, and stomach 45.
Great. What are the starting points for the arm yin channels?
Lung 11, pericardium 9, and heart 9.
What are the starting points for the leg yin channels?
Spleen 1, liver 1, kidney 1.
What are Where are the Jingwell points located?
At the tips of the fingers or toes.
Describe the Ying Spring Point or describe the location.
So from the second point of the five, and in all cases, the second point along the channel.
Shu Stream.
The third point of the five, and in all cases, the third point along the channel, except for gallbladder channel, where it's the fourth.
Yes. The only exception is the gallbladder. The Shu Stream is the fourth. Jing River.
The fourth point of the five, but not always the fourth point along the channel.
Yeah.
would be the
Yes.
one source.
What about the Husi?
Then the fifth point of the five, and in all cases, it's the point at or around the elbows and knees.
Okay. Describe Jing Well point applications.
Uh, the point at which C emanates
So this is where it bubbles. No?
used to
Bubbles the
clear yes, used to clear heat, restore consciousness, and rescue collapse.
mm,
Except for gallbladder 44, bladder 67, and Sanjia 1.
okay.
Last three on the chart.
Okay.
It treats the uppermost reaches of the channels,
Mm.
treats fullness below the heart, and disorders of the spirit, mental state, and quick mood changes.
So it's the opposite, diba? It can clear heat, restore consciousness. Jingwell, the lowest should coincide with the uppermost reaches of the channels. So whatever it is that you want to correct should be the most, the highest, the uppermost. Treats fullness below the heart. And so Jingwell, we associate it with what? Um,
Um,
what element? Wood element. Remember, when you have too much yang happening, it affects your spirit, diba? Mm. Mental state, quick mood changes. What's significant about points located at the end of channels that are most distal?
they are usually the strongest points to clear heat and fullness in uppermost reaches of the channels, especially for acute
Okay,
conditions.
so they are usually the strongest points. So for heat and fullness below the heart, no? Why can Jingwell, spleen 1, stomach 45, kidney 1 treat various kinds of insomnia?
Because the spleen and stomach divergent channels go to the heart,
Mhm.
and the kidney is internally and externally related to the bladder, which goes to the heart.
Yes. Diba? Heart, small intestine, and small intestine is related to the bladder, diba? Taiyang. Describe the Ying Spring na tayo. So Ying Spring applications. Earlier, you described the action of the chi here as gushing, no? Another term would be gliding. Okay, so
Yes. So it clears heat along the channels, treats changes in complexion, treats diseases both yin and yang channels, and the zhang yin organs with a Shu Stream Point or the yin source point of it, yin. It have a strong on action on clearing excess pathogenic factors, stagnation, and heat from their respective channels, particularly from the uppermost regions of the channels like Jingwell.
okay. This is closely related yung function niya sa Jing Well, right? Nagbabubble pa. And the thing here is that when you if you associate the Jing Well with the liver or the wood, so you would associate the Ing Spring with the fire. So there. How do Ying Spring points differ from Jing Well points?
Um, the Ying Spring points can treat disorders of both the whole channel and the upper end of it. Jingwell is just in the upper end.
Yes. So which is better? Ing Spring,
Ying Spring.
because it's the whole channel. Okay. Give examples of Ying Spring points and their actions.
Kidney 2 is the strongest point on the kidney channel to clear deficiency heat from the kidneys. throat, painful obstruction, coughing of blood, genital itching, uterine prolapse, and infertility. Then pericardium 8 clears heat from Ying and blood levels and from the pericardium during febrile diseases. Liver 2 principal acupuncture point to clear liver fire affecting any part of the body, whether blitzing up head and face, disturbing heart and shin, attacking lung and stomach, or disturbing the lower GL.
Yes. So these are actually the 3 stars, no? And kidney 2, we use that for people who are not so young anymore, no? PC8 for those who have been um what's this? Who are having heat, too much heat or fever. Liver 2, too much liver fire. What's the lung Ying spring Shu Stream Point formula and what can it treat?
Um, lung 9 plus lung 10 treats pain of the lungs and the heart.
Okay, remember this. Pain of the lungs and heart. You use the
9 and
Ying
10.
spring. Why did we use Ying spring? Um, so lung 9 plus lung 10. Diba? Lung 9 plus lung 10, pain of the lung and heart. What's the LI, Ying spring Shu Stream Point formula, and what can it treat?
Li2 plus Li3 treats somnolence.
Somnolence, tulog ng tulog. Okay? Li2 plus Li3. So the first one is lung 9 and lung 10. Li2 plus Li3. What about SI?
Si2 plus Si3 plus Li6 for deafness.
Yeah, this is very interesting, diba? Mm.
Deafness.
I can use this on my Si2 plus Si3 plus Li6. This is what we call the SI Ying Spring Shu Stream Point formula. No? Si2 plus Si3 plus Li6. What about the kidney Ying Spring Shu Stream Point formula and what can it treat?
Kidney 2 plus kidney 3, the swelling of the inside of the throat.
Ito sana yung inano natin, no, na nagpa-admit pa. Nakalimutan ko kasi. Yung friend natin.
Na,
Nakalimutan. Ano lang pala, medyo masakit sa kidney 2 plus kidney 3.
2 and 3.
Yeah.
Masakit. Masakit.
Sakit ang kidney 2. PC Ying Spring Shu Sim Point formula, what can it treat?
PC7 and PC8
Yeah,
to
especially
treat
the
heart
whole.
oppression.
Yeah, the heart oppression. Aray, ano ba? Yeah. Liver Spring Ying Spring Shu Sim Point formula, what can it treat?
Liver 2 plus 3, pain of liver and the heart.
Okay. Describe Shu Stream Point applications. Shu Stream na tayo, number 3.
So it's the point at which the qi pours through, treats disorders of the Zhang, combined with Ying spring, treats disorders of the Yang channels that don't have much effect on their Yang organs, heaviness of body and joint pain, not only local pain, but pain along the channel.
Yeah.
Also.
Yeah, remember the formula kanina? We combine the Shu Stream with the Ying Spring, no? Sore throat, swelling, kidney 2 plus kidney 3. What's important to remember about Shu Stream Points?
Uh, not only can they treat local pain, but pain along that channel.
Very good. Which three Shu Stream Points are at the wrist? Where are the others?
Okay. Long 9, heart 7 and PC7, proximal to MCPJ or MTPJ, except for kidney 3. It's behind the medial malleolus.
Yes.
Malleolus.
When the five Zhang are deceased, which point are you going to use?
The UN source.
Yen source point.
UN
When the six Fu are deceased, which point?
lower hussy.
Yes, lower Hossi. Like, what's one of the few Shu streams that can treat the respective Fu organ?
Stomach 43 for stomach and intestinal issues.
Where are the Jing River points located?
At or proximal to wrist ankle joints.
Okay.
Wrist or ankle.
Easy to remember, no? Describe Jing River applications.
It's a point at which qi flows. It treats cough and dyspnea, chills and fever. Treats diseases manifesting in patient's voice and diseases of the sinews and the bones.
Yes. Sinews and bones, voice. Because Jing River is metal. Diba? Metal.
Along
Which Jing River points can treat sudden loss of voice?
heart 7 and pericardium 5.
Oh, not heart.
Combined for heart 4 and pericardium 5. Combined for post-stroke aphasia.
Yeah.
Also Sanjiao 6.
Who knows? Meron kay mahal sa buhay who may have lost his voice kasi may aphasia, kasi na stroke. So remember, but sometimes you
Pwede,
wouldn't know
pwede
what
ba
to
ito pagpaos?
Oo. Heart 4 plus PC5. Also Santiao 6. Ma-remember pa kaya natin to. Heart 4 plus PC5. Bladder 60 is a Jing River point. What is it commonly used to treat? Oh,
Uh, commonly used, stiff neck and contraction of shoulder and back.
yeah. You see, Jing River. Malayo siya, di ba? Bladder 60. GB38 is also a Jing River point. What is it commonly used to treat?
RA and osteoarthritis.
RA or OA?
And OA.
Describe. Our topic for tomorrow pala ha, rheumatoid arthritis.
RA.
Yeah. We will discuss the TCM patterns. Describe the Jose point applications.
It's a point at which the qi enters and boards. Treats counterflow qi and diarrhea, disease of stomach and disorders resulting from irregular eating and drinking. Treats diseases of the fu and can all strongly drain dampness.
Yes.
Also treats uh, diseases of the skin. The LI11, bladder 40, and liver 8 are the most common points.
Ay, nako, you should try this talaga. The moment you see skin disorders, LI11, bladder 40, and liver 8, and also bladder 70. Very effective. 61.
All
What's it?
kinds of skin diseases.
Yes. Kasi usually, meron siyang heat, diba?
Mm-mm-mm. Lalo
Kailangan mo
pag
na,
rare.
itapon mo na siya sa dagat, no? Because you need to make the chi enter. Pabalik.
Mm.
Okay. What's significant about stomach 36?
Uh, It's a principal point for harmonizing stomach and fortifying spleen. For every kind of stomach or spleen disease like NVD.
Yeah, nausea, vomiting, diarrhea. Diba? As the points reach the elbows and knees, they fill in the blanks.
Uh, they have a stronger effect on the center of the body, so the Zhangfu is more affected.
Okay, so as you go to the elbow and knees, it goes to the center of the body. What's significant about bladder 40?
It's the Hussey point indicated for sudden turmoil disorder of with abdominal pain, vomiting and diarrhea, and dysentery.
What are indications for GB34 as Hussey point?
For vomiting,
Due,
uh, due to Xiaoyang pattern or jaundice.
yeah, okay. What are the lower Hussey points and their indications? Lower Hussey, ha? Iba yan siya sa Hussey. Let's start with
Oh,
GB34.
or lower Hussey of the gallbladder treats disorders of the gallbladder directly.
Yes.
Stomach 36,
Yeah.
lower Hussey of the stomach
Yes.
treats disorders of stomach directly. Stomach 37, lower Hussey of LI.
Mhm.
Essential point for regulating intestines and clearing diarrhea, damp heat, and used for all intestinal diseases.
Yes.
Stomach 39, lower Hussey of SI, not as common as 37, but has a similar range of action.
Okay.
Bladder 39, lower Hussey for Sanjiao,
Mhm.
good for water transportation issues. For distension and fullness of lower abdomen and constipation, enuresis or retention of urine and edema.
Yes.
And then the bladder 40, lower Hussey of the bladder, acts on the T transformations function of bladder and important for treating urine retention and difficulty urination.
Yeah. Actually, if you need a bladder 40, naiihi talaga yung pasyente. And also spleen 9. What are points that double as Hussey and lower Hussey?
Um, blood, gallbladder 34, stomach 36, and bladder 40.
Okay. Good. What are indications for LI11 as Hussey point?
It's for erysipelas, urticaria, wind rash, dry, scaly, tachycardia skin, shingles, pain and itching of the whole body as if bitten by insects. Parang
What are
sakit lang.
yeah, indications for bladder 40 as Hussey point?
Uh, erysipelas, eczema, and urticaria.
Kidney 10 as Hussey point. Excuse me.
Itching of the scrotum.
I'm sure you're familiar with the scrotum, no?
Mm-mm. Sa itch.
What are
Okay.
indications for PC3 as Hussey point?
Wind rash.
Yes. What are indications for SJ10 as Hussey point?
Urticaria.
What are indications for liver 8 as Hussey point?
Genital itching.
Yes. According to Nanjing, Classic of Difficulties, what are Jing Well indications?
Fullness below the heart.
What are Ying Spring indications according to Nanjing?
Hot sensation of the body.
What about Shu Stream indications?
Heaviness of body and joint pain.
What about Jing River indications?
Mm, breathlessness and dyspnea, cough, and hot and cold sensations, fever or chills.
Yeah, especially yung mga wind invasion, no? Wind cold, wind heat. According to Nanjing, what are Husei indications?
For counterflow chi and diarrhea.
What is the pathogen for Jing Well points?
For the liver.
Yes, liver pathogen, like emotions, no? Too much fat. What is the pathogen for in spring points?
For the heart pathogen.
Pathogen for shoe stream,
Spleen pathogen.
like ice cream. Jing River points, pathogen,
Lung pathogen.
like wind, cold, diba?
Like lympho.
Yeah, rain, water. What is the pathogen for Jose points?
Kidney pathogen.
Okay. According to the Ling Shu spiritual pivot, which 2 points, when combined, can treat yang channel disorders?
The Ying spring and Shu stream.
Yes. What about yang organ disorders?
Lower Hussey.
Okay. Skin issues,
Uh, Hussey points of the Yang channel.
sinews and bones,
Jing River points of the Yin channel.
yang organs,
Luo connecting points.
yin organs.
Ying spring and Shu stream points of the Yin channels.
It's like earlier, di ba? Kidney 2, kidney 3, di ba? Lung 9, lung 10. What is the function of the Jing Well point?
To clear heat, restore consciousness, and rescue collapse. It also treats
Hindi,
uppermost.
no, that's the Ying Spring.
Is it? Mali daw.
Mali. Mental illness.
Balik.
Chest stifling fullness under the heart.
Iba pa rin yung
What is the function? Ito na yung dapat. Febrile conditions, complexion change, hot sensation, clears heat, fire on yin, water on yang. Shoot stream. Shoot stream, think of P syndrome. No? P, wind dump, heaviness, joint pain. Pathogenic factors enter here. The defensive chi concentrates here. What about Jing River Point?
cough.
Of course, the metal. We have asthma, cough, voice change. So the pathogenic factors are deviated towards.
Sinews and bones.
Yeah. What is the function of the Husi point?
Counterflow of chi.
Yeah, and diarrhea,
Diarrhea.
rebellious chi. What is the function of the lower Husi point?
That for gastric pain.
Yeah, they treat the six fu.
Or
They treat yang because they are in the lower part of the body.
Hussey.
So mas effective siya for yang illness.
Miraculous pivot.
The point at which the chi emanates or bubbles.
Jing Well.
The point at which the chi glides.
Ying spring.
The point at which the chi pours through.
Shu stream.
The point at which the chi flows.
Jing River.
The point at which the chi enters inward.
Hussey.
Yes. And finally, on the yin channels, the yang source point is the same point as the.
Shu stream.
Yes. When the disease is at the zang, needle the what?
Jing Well.
Yes. If the disease manifests as change in color or complexion, what do you needle?
Ying Spring.
When the disease attacks intermittently, needle the.
Shu Stream.
When the disease manifests as changes in the patient's voice, needle the.
Jing, Jing River.
Kung complexion, what do you needle?
Ying Spring.
Okay. If there is disease of the stomach and disorders resulting from irregular eating and drinking, needle the.
Hussy.
Yeah, counterflow chi, di ba? In cases of deficiency, blank the mother.
Tonify.
In cases of excess, blank the child.
Reduce.
Thank you very much. Congratulations.
No.
Wow, perfect score. Please join us again next time.